everyone, it's Jennifer, and I'm back again with my series on the eyes. So I'm going to talk to you about macular degeneration and tell you all about it. So what is macular degeneration? It is the leading cause of irreversible vision loss with people over the age of 50. So, the origins of AMD are still unknown. Science has uncovered many of the genetic and environmental factors that contribute to its development, along with the body's malfunctioning mechanisms that cause the deterioration of the macula, the central portion of the retina. The retina is the thin tissue that lies at the inside back layer of the eye, transforms light from the images we see into nerve impulses, then sends them via the optic nerve to the brain, where vision occurs. The macula is responsible for capturing detailed information from the center of our visual field and gives us our ability to read, drive a car, recognize faces, perceive color and contrast, and see fine details. Alright, that's really cool. When the cells of the macula deteriorate, images are not received correctly. In early stages, macular degeneration does not affect vision other than diminished ability to see in low light. Later, if the disease progresses, people who experience wavy or blurred vision, and if the condition continues to worsen, central vision may be completely lost. People with very advanced macular degeneration are considered legally blind. Even so, because the rest of the retina is still working, they retain their peripheral vision, which is not as clear as central vision. Types of macular degeneration. There are two basic types of macular degeneration, dry and wet. Approximately 85% to 90% of cases of macular degeneration are the dry, atrophic type, while 10 to 15% are the wet, exudative type. I have the wet type. Okay. Stargardt's disease is a form of macular degeneration found in young people caused by a recessive gene. So, the stages of macular degeneration, well, I guess I should tell you about the types, shouldn't I? So let's talk about the types. Alright, let me find it. They are named for the kinds of, the wet and the dry are named for the kinds of physical changes that affect the retina, in particular the macula. Okay, all AMD starts as the dry form, which may progress from early to intermediate and advanced stages, the last of which is called geographic atrophia. In 10 to 15% of patients with dry AMD, the disease converts to wet form, which is also an advanced form of AMD. The conversion to wet form can occur at any stage of dry AMD, but is more likely in the intermediate and advanced stages. In wet AMD, faulty blood vessels grow and leak fluid behind the retina, causing sudden dramatic visual distortion and irreversible vision loss. Patients may have dry AMD, wet AMD, or both at the same time, in either or both eyes. This may sound confusing, but the dry and wet forms of AMD are not mutually exclusive, which means that the dry form may continue to progress in an eye that has developed the wet form and vice versa. Many patients report that they were first diagnosed as having wet AMD. If you notice changes in your vision, went to an eye care specialist and received a diagnosis of wet AMD, that means that your dry AMD was undetected, usually because people don't start seeing an eye doctor until there are problems and transformed into wet. This is why it's important to learn the risk factors for AMD, especially family history of smoking, obesity, poor diet, high blood pressure, and high cholesterol, and to schedule regular eye exams starting as early as 40 years of age if you are at increased risk. Dry AMD is a broad term that covers all forms of AMD that are not wet. In dry AMD, waste material generated by the intense metabolic activity of photoreceptors in the retina accumulates behind the macula and forms deposits called drusen. In older people, having some smaller drusen is considered normal. But in a person with AMD, the body's waste removal system cannot adequately remove this material, and over time the drusen increases in number and size. Drusen is made of fats combined with proteins, much like the plaque that line blood vessels in cardiovascular disease, and they hinder the absorption of nutrients that are normally delivered to the photoreceptors by the capillary-rich tissue of the retina called the retinal pigmented epithelium, RPE. With less access to necessary nutrients, photoreceptors start to die, which leads to reduced visual acuity, color vision, and also a loss of contrast sensitivity. When drusen become larger, they can physically push photoreceptors out of their normal position, which can create distortion that causes straight lines to appear wavy. When enough photoreceptors die, a dead zone appears in our central visual field. According to the American Academy of Ophthalmology, drusen are not the underlying cause of AMD, but the presence of a significant number of large, soft drusen is a sign of AMD, dry AMD. Dry AMD is also referred to as atropic AMD because it causes a thinning or atrophy of the macula. Non-extrusive AMD is another term for dry AMD, which simply means that it is not wet. While no treatments currently are available for dry AMD, several are in clinical trials and may soon reach patients. Until then, the best way to manage dry AMD is to slow its progression by managing risk-reducing lifestyle choices. Stop smoking, eat an AMD beneficial diet, maintain proper weight and blood pressure, exercise, and protect your eyes from damaging light of the sun. It's kind of interesting. I like that. I was actually, not that it's important, I was diagnosed in my 20s with dry AMD. Alright, the stages. There are 4 stages of age-related macular degeneration. Subclinical AMD. Before any of the visible physical changes of the macula that accompany the later stages of the disease, people start to lose their ability to adapt to dark surroundings. This loss of dark adaptation is more pronounced than the loss of dark adaptation that happens to most people later in life and must be measured in a doctor's office. Early AMD. Most people do not experience visual loss in the early stages of AMD, which is why regular eye exams are important, particularly if you have more than one risk factor. Early AMD is diagnosed in the presence of medium-sized drusen, which are yellow deposits beneath the retina. Intermediate AMD. At this stage, there may be some vision loss, but there still may not be noticeable symptoms. A comprehensive eye exam with specific tests will look for larger drusen and or pigmented changes in the retina. Late AMD. At this stage, vision loss has become noticeable due to either advanced dry AMD or geographic atropia or wet AMD. Interesting. If you've already been diagnosed, okay. The causes. The specific cause of macular degeneration is not conclusively known, but the interplay between known hereditary and environmental factors is complex. The more that scientists understand the mechanisms that cause the cells of the macula to deteriorate, the more potential treatments can be developed to slow or stop the disease. The challenges are great because multiple genes are associated with AMD, and environmental factors also impact the disease. The biggest risk factor for macular degeneration is age. Your risk increases as you age, and the disease is much likely to become apparent in those 55 and older, even though it might start to develop earlier. So there's other risk factors to include genetics, race, smoking, diet. Treatment. There is currently no known cure for macular degeneration, but there are treatments available for the wet form of late AMD. There are things you can do to reduce your risk and possibly slow progression once you've been diagnosed. These consist of lifestyle choices, whose benefits are cumulative, meaning 2 is better than 1, and 3 is better than 2. Avoid smoking, eat an AMD healthy diet, exercise regularly, maintain the recommended body weight, maintaining a recommended blood pressure, and protect your eyes from UV light. An educated, motivated patient who takes an active role in the aspects of the disease management that they can control is likely to have the best outcomes and preserve more vision. The impact. In addition to vision loss, AMD can affect your mobility, your independence, your ability to perform household activities, like cooking and maintaining your finances, relationships with others, and your sense of self. Depression, cognitive decline, and overall decline in health have been associated with AMD. There is suggestions that you seek out resources to help you to address any of these comorbidities. Start by asking your doctor and take advantage of resources. So, the American Macular Degeneration Foundation supports important research into the causes of AMD, potential cures and treatments, and to the developments that can improve the quality of life for those affected by the disease. And you can make donations to the American Macular Degeneration Foundation, which is really cool. And there are links to resources on that website. So, if you would like to know, that's where I've got the majority of my information from. I live with AMD and diabetic retinopathy, and I do have low vision. And I use a lot of different visual aids, and I have been through a lot of stuff. Let's see if I can find where they do treatments. There we go. Treatments for wet AMD. I do receive this. They are EYLEA eye injections. It's an anti-VEGF therapy. That is when I receive EYLEA injections. When I first started receiving those, I got them every month. The injection is directly done into the eye, intravitreal. It is, let's see if I can, it is anti-VEGF injections. The other types of injections are Lucentis and Avastin. They work ways to inhibit blood vessel growth at the back of the eye. Vascular endothelial growth factor is what they are injecting. So it's an anti-vascular endothelial growth factor. It's a naturally occurring protein in the body. VEGF is. And its normal role is to trigger formation of new blood vessels, supporting the growth of the body's tissues and organs. However, in certain diseases, such as wet age-related macular degeneration, it is also associated with the growth of abnormal new blood vessels in the eye, which results in scarring and loss of central vision. So, these injections will work to inhibit the binding and activation of the VEGF receptors. The treatments are administered as intravitreal injections directly in the eye. Having regular shots in the eye do take getting used to, but the treatment is actually short. It is pain-free, but I still have issues with it. It's not the injection that's a problem. It's washing the eye with the betadine that's the problem. They wash your eye out with the betadine, and I have issues with that for like 3 days afterward. So the injection itself is completely pain-free. Seriously, because they numb the eye. It's interesting, and they tell you about the safety of it, the injections, and it is really safe. And I do go get the injections. I started at a month apart, then 2 months apart, and now I get them 3 months apart. And they do both eyes. Every now and again they'll do just one eye, but usually it's both eyes. I just don't like when they wash the eye with the betadine. It's just so painful. It burns, is what it is. Then they do the injection, and then they wash it out real good. They wash the betadine out real good with water, sterile water. But then I still have burning for days after, about 3 days, and then I'm fine. Sometimes it causes me to have a black eye, but that's just because it's an injection. And sometimes when you get an injection, you get a bruise. So it's slowing the progression, which is helping, but I'm still legally blind. I'm always going to be legally blind. It will progress no matter what we do, but at least we're slowing the progression. So if you have any questions about macular degeneration, feel free to ask. Maybe I can help you with that. So please stay safe, be kind to one another, and as always, happy yarning. Bye now.